the month from July 2021 to June 2022, and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at New Webinars, and YouTube at tinyurl.com/newwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, decision-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila. The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and/or last Tuesday of the month from July 2021 to June 2022. and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022, and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, decision-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Pi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, decision-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/mewwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mew Webinars, and YouTube at tinyurl.com/mewwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
God our Father, we come to you in our need to ask your protection against the COVID-19 virus that has claimed lives and has affected many. We pray for your grace, for the people tasked with studying the nature and cause of this virus and its disease, and of stemming the tide of its transmission. Guide the hands and minds of medical experts that they may minister to the sick with competence and compassion, and of those governments and private agencies that must find cure and solution to this pandemic. We pray for those afflicted. May they be restored to health soon. Grant us the grace to work for the good of all and to help those in need. Grant this through our Lord Jesus Christ, your Son, who lives and reigns with you in the unity of the Holy Spirit, God, forever and ever. Amen. Mary, help of all Christians, pray for us. Saint Raphael the Archangel, pray for us. Saint Roch, pray for us. Saint Lorenzo Ruiz, pray for us. Saint Pedro Calungsod, pray for us.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM live stream. The title of this forum is HPV Gone Viral. Why? Or HPV Gone Viral Bakit? Today's forum aims to elaborate the reasons for the rising HPV infection rates in the country, as well as ways of educating the populace for HPV prevention. For today's forum, we have Dr. Maria Rowena del Rosario Raymundo, the Vice Chancellor for Academic Affairs, OIC, and Assistant Professor 5 of UP Open University, subspecialist in infectious disease, and consultant of San Pablo College's Medical Center as our moderator.
Hello, everyone. Thank you for being here with us again today in the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. I'm Dr. Wendell Rosario Raymundo, UPCM and Mu Sigma Phi Sorority Batch 89, your host and moderator for today. This event is also brought to you by the Mu Sigma Phi Medical Sorority, the Mu Sigma Phi Foundation, UP College of Medicine, Philippine General Hospital, and the City of Manila. This forum discusses some common concerns of women from all ages and walks of life. We are on the seventh leg of our year-round webinar series, and our topic for today is a continuation of our HPV infection series that started 2 weeks ago. If you have questions for our speakers later, you may type them into the Q&A boxes of UPM Livestream and Zoom, or the chat boxes of FB Live and YouTube. 2 weeks ago, we talked about the silent epidemic brought upon us by HPV. Now, let's explore further and talk about our next topic entitled HPV Gone Viral. Why? This forum seeks to identify the reasons for increasing infection rates of HPV and create awareness of public health measures that can be utilized for its prevention. To formally start, I am honored to introduce our esteemed speakers. They are both alumni of the UP College of Medicine and are distinguished practitioners in the fields of internal medicine and obstetrics and gynecology. Our first speaker, Dr. Sonia Salamat, is a member of the UP College of Medicine class of 1995. She had her residency in internal medicine in UPPGH and fellowship in adult infectious disease in the same institution. Thereafter, she pursued further studies in public health. Currently, Dr. Salamat is a medical specialist 3 in PGH, training officer, and clinical associate professor in the infectious disease section of PGH Department of Internal Medicine. She's also an attending physician and consultant in PGH and Manila Doctors Hospital, respectively. Let us all welcome Dr. Maria Sonia S. Salamat of the Mu Sigma Phi sorority, batch 1995.
Hello, good morning to all the participants of this webinar. A pleasant noon, hindi na pala morning. Okay, I'm going now to share my slides. Okay, so as Dr. Del Rosario Raymundo said earlier, we want to know why are so many people sick with HPV right now? Let me just, there, okay. So we'll be talking about the following: a brief review of the characteristics of HPV infection, but I think this was covered in the previous webinar. So we'll go through that briefly. And then we'll also discuss what factors protect against HPV and what are the factors that promote transmission. And finally, we will be talking about vaccination against HPV. What are the benefits and what are the barriers to this? So the HPV infection has the following features. One of the most important things is that an infected person may not immediately develop symptoms. So the patient remains without symptoms, and therefore that person may probably be unaware or may not know that he or she has the HPV infection. And because of this, the person may spread the infection without knowing it to other people. There are also some people who are infected with HPV but do not develop symptoms at all at any time. And so, again, they will not know that they have the infection. Some people will develop symptoms only years after becoming infected, but before the development of symptoms, they may already have passed the infection on to other people. HPV is spread through anal sex, vaginal sex, and oral sex, and even by close skin to skin touching during sex. Some people, the classic symptomatology that some people get will be genital warts. So the genital warts may also disappear without treatment in some people, but the disappearance of the warts will not necessarily mean that the virus has also disappeared from the body. Warts may develop in both men and women who have HPV infection. HPV infection is linked with the development of several cancers, and cervical cancer is one of the most important of these malignancies. Some people are also not aware that there is a link between HPV and malignancy. How common is HPV in the Philippines? This is a 2009 study, a little bit old, but we see here that for Filipinos, Filipino women whose cervix is normal, the prevalence is 9.2% for HPV. HPV type 45 is the most common. There are many types of HPV, as you already know from the previous webinar. So what are the factors that protect against HPV infection? There are two important factors. One is male circumcision, and second is the use of condoms. So with respect to male circumcision, the Philippines is doing well. In studies, we see that there is a very high rate of male circumcision, as this is part of Filipino culture. However, for condom use, especially among the most sexually active age group, we see here that the rate of condom use at 1.7% is quite low. Okay, so circumcision as a protective factor, we're doing okay in the Philippines, but not for condom use. So what are the factors that may increase HPV transmission? First is early sexual contact and marriage, especially among women, because, of course, the earlier you start getting exposed, the bigger the chances are of getting the infection. Second is the lack of access to healthcare, including HPV screening. And third would be a weak vaccination program against HPV, because as we know, HPV can be can be prevented through the administration of the HPV vaccine. So, vaccination is one of the most effective preventive strategies against infection with human papillomavirus. So, the majority of HPV related cancers are preventable through HPV vaccination if it is administered before exposure to HPV. So in the US, they are already seeing the benefit of giving HPV vaccination. After the HPV vaccine was introduced, vaccine type HPV decreased by 56% from a baseline of 11.5% to 5.1% during the pre-vaccination period compared to the post-licensure period for the vaccine among 14 to 19-year-olds, despite modest vaccination rates. So even if the coverage was not really near 100%, there was already a benefit seen. So the rates of vaccination even in the US have been lower than desired by public health advocacy groups to achieve strong herd immunity, particularly among the age groups in which it is recommended, which is 11 to 12 years old. And also, it has been found that vaccination rates vary by geography, probably reflecting the priority given to HPV vaccination by different places and different local governments in their country, in the US. So, how about the Philippines? So, this is based on the summary report. You see the reference on the lower right-hand corner. This was published on the net, on the website in October of 2021. So the coverage of HPV vaccination in the Philippines is also quite low. So the vaccine was introduced in a to the target population in 2015, mostly for females. And you see here that for the estimation year 2019, only 23% had received the first dose, and only 2% had only completed the last dose. And in estimation year 2020, this did not improve so much from 23% to 20, still at 23% for those who received the first dose. And for those who completed or received the last dose of the vaccination series, it only improved from 2% to 5%. So still quite low. So we do know that HPV vaccination is part of school-based immunization in many provinces in the Philippines, but this was also disrupted by the COVID-19 pandemic. So this is a 2019 news item. What are the other barriers to receiving the HPV vaccine? So partly, the vaccine is perceived as a sex vaccine by some groups of people. So some people think that if the vaccine is given to someone, that person will now think that he or she has the license to engage in sex with many people, for example, because of the protection conferred by the vaccine. So that has prevented the uh, the increase in the rates of the vaccination among some groups. Also, initially, the vaccine was only recommended for females. And this also contributed to the perception that the HPV vaccine might be treated as a quote unquote sex vaccine. Also, it has been found that if a health provider does not strongly recommend the vaccination to parents, then these parents are much less likely to have their children vaccinated. So I think that makes a lot of sense because the parents will also be looking to the health provider for for advice and instructions. Some providers have been found to provide recommendations, but they were not very strong recommendations or consistent, very consistent recommendations to the patients. And again, health providers were found to be more likely to recommend the vaccines for females. They don't recommend it so much for males. And also, they recommend it only for older adolescents sometimes. But we know that the target group for HPV vaccination would not be older adolescents since we want the vaccination to be done before exposure to HPV happens. Okay, so this is an example of a communication for parents. So we engage the parents because the parents in turn will also be making this will be making the decision regarding the vaccination of their children. So there was also a survey before about what Filipino women thought about the HPV vaccine. This is a bit old, but I think it also tells us a lot and will also help us in addressing the problem of the low coverage of HPV vaccination. So in a survey of 435 women whose mean age was 24.1 years old, over half reported that they knew nothing about HPV prior to the survey. And we see that the mean age shows that the women were already adults and yet they did not have a lot of information about HPV. And over 76% reported that they knew nothing about genital warts. So obviously the link between HPV and warts was not known to these women, and just under half reported no knowledge about cervical cancer. Still a lot of people, and fewer than 10% of the participants believed that they were susceptible to HPV or to cervical cancer or to genital warts. They did believe, though, that the vaccine could offer protection against cervical cancer and genital warts. 49% indicated that they would be more likely to engage in greater levels of sexual risk behavior if they were vaccinated. And 29% indicated that they would fear getting the vaccine if it were given only for women. So this is consistent with what we said earlier, that the initial recommendation for HPV vaccine, which was made only for women, also probably deterred many people from getting the vaccine. And also, 70% of the survey participants had received a recommendation from a healthcare provider to protect themselves against genital warts. But we see here that there might have been a source of bias here because some of the participants may already have counted the information about HPV given to them in relation to the survey when they answered this question. So this might have been overestimated. Also, I think this is important, that the majority of the participants, 3/4 of them, indicated that other people would be influential in their decision to receive the vaccine. So that other person can be their mother, their husband, their boyfriend, or their partner. So again, other important things we can learn from this survey: over 68% of women reported that they would most trust a female physician compared to 1.3% only for a male physician. So the participants preferred that a female doctor will be giving them the recommendation and the vaccination, since 71% also indicated that they would be more willing to receive the vaccine if the healthcare provider administering it was female. So that's it. That's it for my lecture. So we see here the different reasons why we have a lot of HPV infection. And we also saw that vaccination is one of the one of the most effective preventive strategies. And we also saw why we also saw some of the reasons why vaccination coverage still remains low. Okay, so I'll be happy to answer your questions later after Dr. Remollino's lecture. Thank you.
Thank you so much for enlightening us with your talk, Dr. Salamat. You gave us a very clear and yet concise talk on why HPV spreads easily, the factors that promote spread and that protect and prevent HPV, including vaccination. And you also explained what people, particularly Filipino women, think of the vaccine. So thank you so much.
Thank you.
Now, to
Okay.
further enlighten us about this topic, let us now welcome our second speaker, Dr. Marie Catherine Grace Remollino. Dr. Remollino is an alumna of UP College of Medicine class of 1996, and after her obstetrics and gynecology residency in PGH, she took her fellowship in gynecological infections and HIV in Brown University and Miriam Hospital. Since then, she has been practicing as an OBGYN infectious disease specialist. Currently, Dr. Remollino is the Chief Medical Officer of Calamba Medical Center. Without further ado, let's now call on our very own Dr. Marie Catherine Grace Remollino, U Sigma Phi Sorority, Batch 1996.
Good afternoon, Wen. Thank you for that introduction. Good afternoon, everybody. As a disclosure, I just wanted to update everybody that I have been away from the academe for already 16 years now. So it's good to be back again in this talk, and it's good to follow Angel Bandola and Dr. Butch last 2 weeks ago, and Sonia. So basically, this is going to be mostly from the clinical end of HPV education, how to translate our researches and our processes into the grassroots of healthcare. So just an outline, I'll just give a little summary of what was given 2 weeks ago, just so that we can recapitulate everything that has happened for the past 2 weeks. As Doktora Jalbuena will always say, repetition is a very important way to educate. And if our viewers are able to replicate and share this knowledge to others, then we have succeeded in our talk. So the human papillomavirus has more than 100 subtypes, and there are more types that are coming in as we speak. Infection is usually done when there is a break in the mucosa. So a lot of people think that you need to have penetrative sex to have incorporation of the virus into your mucosa, but non-penetrative, oral, and other forms of sex are also ways of acquiring the virus. So it's something that we need to reiterate to our patients. As the Department of Health has reiterated, that 11 Filipino women actually die from cervical cancer. And be that cervical cancer is one of the most preventable and treatable forms of cancer, the question will remain, why are we not able to make a dent in preventing and treating our cervical cancer patients? So from our data, risk factors, as mentioned by Sonia earlier, young age for your first intercourse, low socioeconomic status, high parity, smoking, use of oral contraceptives, and risky sexual behaviors. As we know, the ideal screening for cervical cancer or HPV disease is actually an HPV DNA test. But in third world countries, we have our liquid pap smears and our single visit approach using acetic acid and colposcopy following for suspicious lesions. So, as we have studied the virus over the decades, we don't just see a correlation now with cervical cancer, which was an emphasized cancer related to HPV, but we likewise saw penile cancer, oropharyngeal cancer, anal cancer, vulvar cancer, and vaginal cancer being correlated with this. So, in as much as if we get to prevent these infections, then we can prevent even more cancers. So again, just to emphasize and reiterate the importance of knowing the possible sexual contacts that have evolved in the decades, we cannot actually assume full protection with condom use. No, abroad they have what they call latex squares, wherein they can use this for oral sex, but locally I have still not seen them. We used to have some condoms wherein the women can protect themselves from the men, but again, I think the supplies have run dry. Now, there are non-sexual routes that are being studied of maternal perinatal transmission, which is very rare, and from fomites, and these are hypothesized but not really well documented. So what is available for prevention, as Sonia mentioned, is we have our bivalent, quadrivalent, and nine-valent vaccines that have been with us for decades already. We have had our studies here in the Philippines contributing to our efficacy studies. And just lately, for this year, we have noted really, indeed, there is a substantial reduction in cervical cancer and CIN3 with the use of our vaccines. So this vaccine really works. And that is why our Department of Health, since 2015, has come up with the implementation of a school-based HPV immunization launched 2015. Unfortunately, because of the COVID pandemic, this had to stop a bit, but I heard from my patient that they have resumed vaccinations in the schools, even in the provinces. So this is good news. So when we speak about the vernacular, no, Marites will ask, ano magagawa ko para hindi magkaroon ng HPV? Because usually we only get scared if our relatives get sick, if our neighbors get sick, if an artista gets sick. And there are really a lot of things that we can do. Now, from a global perspective, the WHO wants to put an end to sexually transmitted infections. I remember as a medical student, this has always been a goal that has not come to be fulfilled. And so, what are they trying to achieve? No, what we want is, because of the burden that all these sexually transmitted infections have, no, causing fetal and neonatal death, cervical cancer, infertility, increasing the risk of HIV, having psychological and social consequences. It wants 2030 to be the target wherein we want to end sexually transmitted infection epidemics as a major public health concern. No? So it's something that globally we want to reach. And specifically, we want to zoom in to the human papilloma virus. So they came up with a 90-70-90 goal. No, I call it my VST. So those of my age will remember that band. No, so 90% vaccination reach is the goal. So from what Sonia said, I think it was like 23% still at that time. They want to reach 70% screening. No, unfortunately, the screening data that we see is around 10% of women are being screened, and mostly these are by VIA rather than the ideal HPV DNA test that is being recommended. and 90% treatment of our CIN and cervical cancer. So this is really a Herculean task, but I believe that we may set our goals high. If we cooperate and we are able to do our part, then we can make a dent into this goal. So when we take a look at the continuum of STI services, we want to help in terms of prevention. This is where education will come in, testing, linked to care, and treatment. So these are the vital parts of our prevention. No? So we always say, this is something that I really would like to emphasize, a couple's approach, wherein when someone is being treated for any STI, is to give that treatment for the couple's partner or partners, so that we can control the disease more effectively. So Marites will always say, ano ibig sabihin yan? No? So we have to be able to translate that to day. So healthy lifestyle, because most of us will clear the infection with our good immune system. Abstinence, being faithful, condom use, and seeing your doctor for your screening tests as recommended. We also would like to emphasize that abstinence would actually be the best way to prevent HPV infections. No? Also, when we talk about screening for HPV, we have our conventional pap smears. We do teach our barangay, our midwives in the grassroots to do VIA. We do our pap tests with the DNA HPV testing. Now, there are several barriers that come out with why we are unable to screen our patients. And it really is a matter of economics, geography, psychosocial. Until now, in Laguna, some women will say, linisin nyo ako, doktora, which is what they think pap smears are all about. No? So again, this is what we recommend now, to have our HPV DNA test at the age of 30 and every 5 to 10 years interval. And those living with HIV will have it more often. So in our various organizations, the POGS, the CCAP, DOH, embraces the WHO goal for 2030. And we hope that we would be able to avoid the burden of cervical cancer in 2030. Taking care of the common myths about HPV is very important. No? So a lot of women will say, when they get the virus, they always will say, oh, my partner was not faithful, because you cannot really time when the infection was acquired. No? I will have HPV the rest of my life. Most of the viruses are cleared by the body, again, by a good immune system. All HPV infections lead to cancer. Not all infections lead to cancer. And then even consistent condom use will not be able to prevent all HPV infections. So you still have to remember, no, that it can happen to anyone. It can happen to a monogamous woman who has a partner who has multiple sexual partners. And we have to believe that we can set our eyes on the 2030 goals of WHO. So there are a lot online. There are a lot of educational materials that we can share. And what we want to emphasize really for this talk is that HPV disease and cervical cancer is preventable and treatable. And we have a vital role in participating in educating the population. So it is not just taught in schools, in fora like this, but it is taught in every household. So if you are a mom, no, if you are a sister, child, my question is, have you had your vaccines? Does your family have complete vaccination? Does everybody get screened for cervical cancer or for all cancers for that matter? Is your best friend protected from this disease? Is your school mom, are the moms in your school all protected? And then are the children protected? And the time to start is now. I remember that there was this ad that said there was this child who was asking their mom, "Mom, did you know? Did you actually know that you could have prevented cervical cancer?" So let us be proactive. Let us not wait for the disease to come to our family. Let us not wait for the disease to come to our community. Let us help each other by being venues of education, by being conduits of bringing people to proper care, to proper treatments, and to proper screening. So VST, no? Vaccination, screening, and treatment for cervical cancer and HPV disease. So I hope this session will be something that can spark a change with everybody. Thank you very much. I'd like to thank Dr. Butch Manalastas, Dr. Jean Toral, and Dr. Sonia Salamat and Ivy Advincula for helping me with this talk. Good day, everybody.
Wow, thank you, Dr. Kat. Thank you so much for your insights on HPV. Your talk certainly enlightened us on strategies to end HPV disease and cervical cancer. You mentioned strategies from WHO, DOH. You also mentioned as well common misconceptions about HPV and how to educate people both on what to believe in and also how to prevent HPV and protect themselves and their loved ones proactively. Sabi ni Dr. Kat, be proactive. Now, you will agree with me that both of these talks provided us with so much relevant information on how we can strengthen our fight against the rising HPV infection rates in the country. And of course, patient education, aside from the public health measures mentioned, play a key role in improving our current state in fighting this battle. So healthcare professionals and educators really play an important role in making sure that the patients get the best treatment, but everyone else as well has their own role to play. Every single one of us can help against this fight. Now, to give some of her insights on today's talks, we also invited a guest reactor, Miss Raquel Borja-Chua. Miss Raquel is the owner and chef of Mama Chow's, which offers lactation cookies and pastries for the delectation of moms everywhere, aside from other yummy goodies. Being a self-proclaimed introvert, baking became her outlet to express her creativity. And now she's a mother of three wonderful kids, and so she's also an advocate of breastfeeding. And she fueled her passion into making baked goods that will benefit mothers. Aside from baking, Chef Raquel also has her own blog where she shares her breastfeeding tips and personal stories about her family. Later on, we'll share her social media account so that if you would like to get in touch with her or try her cookies, you may do so. But first, please join me in welcoming today Miss Raquel Borja-Chua. Miss Raquel?
Hello everyone.
Hi.
First, I'd like to thank Dr. Marie and Dr. Sonia for the lecture today. It was very informative. I myself at 42 learned a lot today. I never knew those things before because mainly it was like a taboo for everybody to talk about that unless you're talking to your OB when you have questions like that. And then I learned one of my takeaways is that I have a daughter who's 7 years old. So now I have to prepare to one day have that talk with her that, this will happen. And then now I have to include the boys also because I have 10 years old and 7 years old. My youngest are twins, girl and boy. So siguro silang dalawa will have it on different approach of talk na, you're a boy, you have to be circumcised. This is not just because you're gonna be an adult soon, but because you have to do this for yourself also. It has a deeper meaning now. Before kasi parang, oo, papatuli mo yan kasi para tumangkad. Hindi pala para lang tumangkad. It's more, there's more beyond ng pangpatangkad lang. And then now, of course, I have a daughter that I need to. And before kasi share ko lang sa inyo lahat. I got my vaccine when I was in my teens because it was not explained to me why I needed the vaccine. It was just because my mom, so the study is true that you get it from your mom. It was just because my mom said, oh, your grandma has cervical cancer, so you have to have your vaccine. So the three of us, me and my other two sisters, we just go with the flow. We went to the doctor. The doctor who vaccinated us was my aunt, was our pediatrician. So we just got our vaccine and then that's it. No, nothing, no explanation of why we're having the vaccine. It's just that we have the fear that we might get the cervical cancer because our grandma had it. So this is something really that we have to have like a series of talk or a more talk like this, because not everyone, me in particular, I don't think I see myself sitting and having coffee with my friends and then we'll just one day out of the blue we'll talk, oh, you have ano ba? Meron ka bang genital warts? So kasi it's so taboo eh. It's not like it's very common na parang hindi mo siya pwede pag-usapan on a regular basis, and having this kind of talk would open our eyes to have more conversation. Talaga parang pag sinabi, when I was invited here, sabi ko, ano ba yung ibig sabihin ng HPV? I did not know na it was that they're referring to. I thought it was something else kasi maraming silang ngayon, di ba? Kung ano-anong words na invento nila. So parang sabi, ano ba yung talk na yan? So it's really something that we have to make effort to talk to our friends about. And then, Doc, I have a question po. Like me, I had my vaccine during my teens and I am now 42. Do I have to have my vaccine again, and do I have to have a screening aside from my yearly pap smear?
Okay. Thank you, Thank you for that question, Miss Raquel. Miss Raquel has a question for any of our speakers, and she's asking. Basically, what she's asking is that if you have had the HPV vaccine earlier on, do you need to have it again, and do you need to have other examinations such as screening or PAP, even if you've had it? So before we go to our formal Q&A, I think we can go on ahead and address her question. What do you think, Kat and Son? Let's go with Kat. Sige.
Okay, I'll take the question. Thanks, Raquel. No, so as long as you've completed your series, your 3 shots, or 2 shots, if you got it before the age of 15, then the studies have shown that you do not need any booster shots after. So you're good. But having the shots is not a guarantee. Like so you need to have your screening. And right now, as I mentioned, the screening is the HPV DNA done every 5 years, starting at the age of 30. Or if you have your pap smears, your liquid pap test, you can do that every 3 years. So it doesn't mean that just because you have your vaccine, then you will stop screening for cervical cancer. So it's good that you had it. Great job to your mom, and you can do the same to your children when the time comes. So for your 10-year-old, you can actually start talking and have them, because in terms of, is it okay when in terms of economics, we do look at two shots being more economical than having three shots. So for the younger generation, if you get to give them before the 15 years old, then you'll only be using two vaccine shots instead of three. So that will be more effective, cost effective.
Doc, the vaccine is for women only, for female.
No, there is already indication for the boys. So if I may share, that's why I had the picture of my boys towards the end of my talk. We had a long talk, and my sons were saying, "But mom, I don't have a cervix," no, because they know that when we were doing the research for cervical cancer vaccine, they were there with me, and I was explaining to them the disease. But because there is good correlation with anal and penile carcinoma and oropharyngeal carcinomas, they already advise it. In developed countries, it is part of their pediatric armamentarium of vaccinations. And so my son even said, "But mom, I won't do it in the act, no, and or I won't, no." And what I realized in practice is if you don't ask, they won't tell you. So when I ask my patients, in as much as they're very comfortable with me, they do tell me that they engage in oral sex, they engage in anal sex, no, and these are things that we'd like to help them with, because they usually do not understand the implications and the possible consequences of such practices.
Okay, Doc, like you said, no, so boys can have their vaccine also. Do we vaccinate them before the circumcision? Because my son is not yet circumcised. We did not offer that during yung pagpanganak nila. So do we circumcise them before the vaccination, or it doesn't matter?
It doesn't matter. It has nothing to do with the vaccination. These are preventive vaccines. So the best is really to vaccinate them before any exposure to the virus. So in as much as we'd like to think that our children will remain virgins until they get married, at this day and age, I feel so old. I feel so manang, because most of my patients are not married and they're pregnant. No, so the truth is, sexual intercourse starts earlier than we'd like to think.
Thank you,
That's
Doc. Thank
a
you.
very good insights. And thank you, Raquel, for asking that. Kasi alam nyo, these are very relevant questions that not many mothers or even like women can get to ask, right? Because some of it involves some, taboos, or like what Raquel said, hindi mo naman matanong eh. 'Di ba? Basta-basta. And you're also very concerned, especially with your children. So those questions are very relevant. And in fact, I believe in a way it has also answered the first question in the chat, because we had a chat question asking, can my daughter aged 11 years old be vaccinated with HPV? And that has been answered, right? And it also answered the question as to whether the boys can also be vaccinated. So thank you, Kat and Raquel. Now I'd like to move on to another question in the chat, and this time it's for Dr. Sonia. And it also has to do with that actually, yung parang confidentiality. The question in the chat reads, maybe some patients refuse to get vaccinated due to unnecessary judgment, or maybe they're confused. How do we encourage them to be vaccinated? Is there a confidentiality or privacy approach for these patients who want to get vaccinated with HPV, but they're hesitant because of the stigma that this might convey? What about it, Sonia? What do you think about this?
Okay, thanks, Wen. Yes, definitely. Like the way we do it with everyone, all our patients, doctors will always practice confidentiality. Will make sure that your information or your consultation will remain confidential. Hindi naman namin yan i-chismis dun sa ibang tao. Tapos, for example, if a young woman comes in for HPV vaccination, young but old enough to be able to consent for herself, to give consent on her own, we're not going to make chismis to her parents, for example, o yung anak mo nagpa-vaccine. Syempre hindi. Syempre we will respect the privacy of that person, and we will make sure that the patient's information will remain confidential. Siguro maganda nga yon yung approach mo. Mararamdaman talaga ng pasyente na hindi yun makakarating kung saan-saan. Tapos siguro maganda din na yung attitude din natin sa HPV vaccine, hindi natin siya ituturing na parang, "Uy, huwag ka maingay papa-HPV vaccine kita." Dapat hindi gano'n. Kasi
Huwag
hindi
sasabihin yung mga gano'n, diba?
sabihin, oo,
Secret natin. Oo,
Oo,
sabihin. Oo. It adds to the, you're correct, no? It adds to the, parang, if you don't put malice in it, tapos bigla na lang sasabihin sa'yo na, huwag sasabihin, di parang iisipin mo, is there something wrong with it? So that's a very important point. Oo nga naman, minsan di natin naiisip yun. Huwag mo sabihin kay Lola, napupunta tayo sa yung mga ganun, di ba? So that's true. I like that. It's very relevant talaga. Especially in our culture, di ba?
Oo,
Yung mga,
diba? Yung intriga, yung minsan nagiging intriga, hindi naman dapat ma-intriga, kunyari. Pero,
that's true. Thank you for that. That's a good point. What about, kasi we've talked about, this one naman is for either Sonia or Kat, and if Raquel, if you have any comments, you can also chime in. We have a question here kasi di ba pinag-uusapan naman natin yung bata, di ba? Yung kung pwede ba yung very young, like 10 or 11. May tanong naman sa Q&A, sa Q&A box. Yes. Is there an upper age limit naman for HPV vaccination? Kung si Lola gusto magpa-vaccinate, pwede ba yun? Or baka meron bang recommendation against that? What do you think? The senior population.
You want to answer, Swans, or
ikaw muna, Kap.
Oo. No. If you go to the US, no, they have an upper limit, a 45-year-old upper limit for the vaccinations. But here in the Philippines, there's no upper limit, no? So 9 and up, no? And this is something that you can discuss personally with the patient, no? It really will depend in terms of her comfort, or if she feels that she needs it, no? The oldest that I vaccinated was actually 54, no? She's had medyo hugot parang yung sumakbilang bahay si daddy niya, tapos so she feels she needs protection and all. And I said the benefit is much better when you're younger. So as I said, Raquel, before they get exposed to the virus, that's the best, no? But she was willing to receive it, so I gave it at 54. So
Kasi basta may di ba? Basta pwede pang ma-expose sa dami kasi ng HPV types. Di ba? Pwedeng hindi ka pa na-expose sa lahat na yon Parang baka hindi mo pa naman naubos. So pwede pa rin, may benefit pa rin kung sexually active ka.
And I recall during as a matter of disclosure, kasi I was also involved in the HPV vaccine trials, I remember before there were findings pa na, syempre, as expected, the first peak of, HPV, the incidence is syempre doon sa reproductive age. Pero, di ba, there were reports of a second peak towards the senior.
yes.
Oo, di ba? Doon sa latter age. Ang lang naman doon is, hindi namimili ng age. Hindi ibig sabihin na, tama nga yung sabi ng ating mga speakers, hindi naman ibig sabihin sa dami ng HPV types, hindi naman ibig sabihin na pag matanda na tayo or kapag nagkaroon na tayo, hindi na tayo magkakaroon ng infection with the other HPV types, diba? So, ganun nga. I also agree, no? I've heard of iba-iba ang practice sa iba-ibang countries. Yung iba nagsiset ng cap, yung iba hindi naman, no? Like in the Philippines. Ang importante doon, dapat siguro isipin natin, hindi lang limited doon sa reproductive age group, hindi yung risk, di ba? Yung risk talagang walang pinipili. So, valid pa rin naman yung mabigyan ng vaccine, no? Kahit sila lola. Eh, meron naman tayong question na isa, no? If they do not have a family history of cervical cancer, wala namang family history of cervical cancer, do they still need to get, is it still advisable to have the vaccine? What do you think? Any of our speakers can answer. Yes, Kat.
Oh, it cervical cancer is predominantly HPV related. So it's 99 point something percent HPV related rather than a genetic predisposition. So that's why the statement is it is preventable with a vaccine and it is treatable by screening early and treating early. So kahit wala kang kamag-anak na may cervical cancer, you will benefit from the vaccination. And to talk about the vaccine being taboo again, Wen, no, and Sonia and Raquel, I came across a study that they really want to even start it earlier para yung mawawala yung pagiging taboo na younger. They were doing a study for 8-year-olds, no? So yan yung mga, Raquel, wala ka nang reklamo. Dadaling ka ni mommy sa pedya mo, tak, tapos na, no? Because nga, the correlation is so strong, no? There really is no need to really wait as long as the studies so far are showing that the immunogenicity is good enough to last long enough. So yun lang yung ating aabangan, no? So the study that came out 2021 this month actually shows that it really has decreased cervical cancer and HPV disease.
Thank you, Doc Kat. For Doc Sonia, I have a question related that you actually mentioned in your talk. How do we debunk or address the perception that this vaccine will more likely engage people in greater levels of sexual risk behavior? Di ba ina-mention mo yun, yung sex vaccine?
Oo.
Paano nga ba gagawin natin dyan? More specifically, paano natin i-convey sa patients natin na hindi naman sex vaccine yan?
Oo, hindi siya sex vaccine kasi ang talagang gusto nating mangyari, 'di ba kaya ang laman na HPV types ng vaccine, mainly yung carcinogenic, yun yung emphasis. Pero meron ding ilan na hindi masyadong carcinogenic pero yung sa warts naman. So siguro, ang pwede nating sabihin doon, well, we'll emphasize that the HPV vaccine is primarily for protection against malignancy. Kasi kung warts lang, di ba, hindi naman yun nakakamatay eh. So siguro, hindi tayo kailangan gumawa ng vaccine para sa isang kondisyon na hindi naman masyadong seryoso. Kaso ang problema nga, pwede ngang mauwi sa cancer. Di ba, after several years, that person can develop cancer because of the HPV infection. So siguro yun ang emphasis natin dapat. Tapos sasabihin din natin na hindi ito sex vaccine kasi hundreds nga of HPV types. So kung sex vaccine din lang, ang ginawa natin, vaccine na may 100 types para sex vaccine. Pero hindi pa nga din kasi ang HPV naman, isa lang siya sa mga sexually transmitted infection na pwedeng makuha ng isang tao. Diba, ang dami ng mga iba pang STIs na pwedeng makuha. So definitely, the HPV vaccine should not be something that will make a person think, oh, I can have sex with everyone. Kasi ang dami namang iba pang pwedeng makuha na walang epekto doon yung HPV vaccine.
That's true. So thank you for that. Ito naman, I'm sure si Raquel and other moms and other parents this is a concern actually for parents who want to have their kids vaccinated. This question reads, HPV vaccination is costly. How can we promote families to get this? Will this be covered by PhilHealth, or are there any groups that that offer HPV vaccination for free? Meron ba tayong ano ba masasagot natin dito? Is this covered? Doc Kat, sa hospital ba? Covered ba would you know if covered ang vaccination?
Oo. Yung as mentioned by Sonia, no, the school-based program of DOH covers it for mga grade 4 students, no? they use the bivalent and the quadrivalent vaccines. Some companies do cover it as salary deduction. That's when we educate the companies about preventive measures. But there are NGOs who help out by vaccination, and Mu Sigma Phi was one of those who actually helped out with the initial rollout of the vaccines. But otherwise, it's something that is out of pocket. And this is one of the deterrents for our patients and the parents of our patients. So what we try to emphasize is if you get to vaccinate them before the age of 15, then you can cut down on the cost. No? Another analogy that I do is whenever we talk about the cost, which would range from around 2 to 7,000 pesos per shot, no? I always say, think of it as an insurance policy na hinuhulog-hulugan mo lang. It's not naman, Raquel, that you have to pay the 3 shots right away. So the schedule is usually 016 or 026, no? Spread out in 6 months, no? So it is not something that para kang bumili ng cellphone, parang ganon. Yun na lang sinasabi ko. And yung cellphone papalitan mo, but your health, no? This is something that you will benefit from for your lifetime. And when we talk about the cost of treating cervical cancer, it will run into the millions, no? And for the amount of money that you put into the vaccine compared to the cost and the consequences of caring for cancer patients, it is really going to be worth it. So that's how we try to explain to our patients if they don't have the money.
Thanks for that, Doc Kat. We have so many questions coming in. Ha? Baka hindi natin masagot lahat, but this one is interesting. Another question from the audience. If you can easily screen females for HPV, how do you do regular screening for males? Diba? Anong sasagot natin dyan? Kasi the females, they already have parang a mechanism for screening. Kasi ang mga babae, matagal na namang nire-require ang pap smear, di ba? Yun yung pinagmula nun no? Pap smear. But for males, do we have any screening procedure for males? Does anyone want to answer that?
Wala pang approved di ba?
Yes.
Yun ang problema Yung sa babae pa lang ang meron Kaya maganda talaga ngayon prevention sa mga lalaki.
Right.
True.
Kasi
and I could imagine sons, di ba, they'll have to do your urethral swabs, and I used to do that in the males, and they're not happy when you have it done, no? There's also proposals for oral swabbing, but they're still not there are no good tests right now because you develop oropharyngeal carcinomas as well, no? So none yet. When invento natin yan.
Oo nga Pero at the same time, there are male cancers that are related also to HPV. So talagang prevention dapat Kasi wala pa tayong pan-screen sa mga lalaki.
Pero hindi ba maganda na tinanong nila? I like that na at least na kasi merong before I think di ba part of the talks was kasi it has been the discussion of HPV has been medyo skewed towards females and di ba nabanggit nyo na maybe one of the complicating factors was that the discussions were initially parang medyo skewed nga sa females, so in-encourage. Tapos di ba there was also this policy na yung mga nagtatanong hindi ba natin ma-vaccinate ang boys. Ang sinasabi kasi mas parang concern yung cervical cancer. So siguro we might start to consider that kapag na-vaccinate na natin or na-address natin yung cervical cancer among the females. Di ba yung ganun yung naging initial policy. Pero tama naman, na dapat you keep in mind na meron din at risk din naman, di ba? At risk ang males. Yun nga lang right now, wala naman tayong approved na procedure from and pati mechanism for that. We have another question here, no? What sicknesses or symptoms are commonly found in HPV infection in males? My kids are all boys and they are not convinced to get shots.
I could imagine. Oo.
Diba? Ano ba ang HPV infection sa males? Kasi sinasabi, sa female, cervical cancer. Diba? Cervical cancer. That's, madaling. Pag males ba, ano ba ang pwedeng makuha ng males? Siguro dapat anuhin natin yung, di ba, yung spectrum of, we're talking about genital infections, di ba? At saka yung nature ng HPV, saan ba siya usually laganap, di ba, sa squamous cells or sa pwede din naman, meron din namang non-squamous pero sa genital area. So, ang question, ano bang kailangang cancers of concern doon pag lalaki? Ano, what are we talking about? Maybe siguro kahit yung buong spectrum of ages of males from childhood to adulthood. Ano bang male cancers ang pwedeng ma-address ng HPV vaccine?
Nasa slide yun ni Kat eh. Maganda yung slide ni Kat.
Sige, Kat.
The thing is, just to regress, no? When we remember before when we were talking about why not vaccinate those males? No, they're the reservoir of the HPV and all that. No, merong mga ganong talk, no. But the correlation is almost 100% really for genital warts, for cervical cancer, no. But for penile cancer, it's around 40%, and I think 60% for 60 to 70 for anal cancer, no. And then oropharyngeal, I forgot na. Hindi kasing taas. It's not as high as our cervical cancer correlation. No, even it's the same almost as vaginal cancers. No, so because of the correlation not being that high, so it was not initially thought of as a cost-effective vaccine. No. But now that they are seeing more and more, I feel that more and more are happening primarily because there is riskier behavior, sexual behavior right now amongst all of us. And this is making the disease more, smarter, or it can persist more. Remember, it is persistent HPV disease that causes our carcinomas. No, if we are able to clear it from our body with our immune system, then the disease may not develop. No, but if it is persistent, it is latent. That is when the carcinomas will happen.
Right. Thanks, Kat. I see Raquel. Raquel was raising her hand a while ago. I'll give the floor to you. Do you have a question?
I have a follow-up question.
Yes.
Doc, question, like you said, no, my husband is now 39. Can he get vaccinated? I plan to bring him and the 10-year-old boy together. And where do we get the vaccine for the two of them? Kasi I mean, like for me, I would just go to my OB, diba? Like how you mentioned about the screening. So I'll just talk to my OB and then tell her, Doc, I want to be screened for this. And then we have the regular yearly pap smear, ganyan. But of course, my husband doesn't have that. And now I plan to bring my 10-year-old for a vaccine. So saan ko sila dadalhin para sabay silang dalawa mag-vaccine?
Good question, ha? Oo nga naman eh. Ang babae may OB.
Oo
diba?
nga.
OB guy. Paano lalaki?
Si Sonia mo dadalhin. Oo.
Son.
Pwede yun. Pwedeng sa internal medicine, yung husband mo, Raquel. Pero yung son mo, dapat sa pediatrician.
Pedia pa rin po.
Sa pedia pa rin.
Pero feeling ko ba mas magandang explanation pag sa hindi pedia. Mas detailed explanation. Pero alam mo yun, mas iba yung approach pa. Pag sabay sila, diba, na explain sa kanilang dalawa. So, hindi pwede yung bata sa internal medicine. So,
Well, I'm not sure if some family medicine practitioners would do that, would vaccinate for HPV. Baka.
Oo. Oo
I
nga,
think
no?
so. Pwede.
Everybody naman can vaccinate. I feel, no?
Yes, everyone can vaccinate naman eh. So I think there might be some med practitioners who do vaccinations at their clinics. Kung
10 years old ba, Doc? Pwede na ba yun pag-usapan sa 10 years old? In denial pa ako.
Alam mo, maganda actually question yan, di
meron na sa
ba?
toddler eh.
May question, magandang question yan. How do you explain this? Or up to what extent should you explain this to your 10-year-old?
Yun pa, Doc. Kasi
Diba?
baka
Oo.
dahil
Kasi ayaw naman natin na yung mga sino ba yung nabanggit kanina na sige dadali natin. Si Kat yata yun. Yung, ka, bakuna, tak. Hindi niya alam.
Diba? Tapos.
Tapos, no? O tapos.
Yun yung logic nila in giving the vaccines together with the catch-up vaccines ng pedya. Wala nang tanong-tanong, di ba? Hindi naman tinatanong, Mommy, what is meningococcal vaccine? Yung ganon. So parang, So para na lang daw walang question, wala silang idea and all. But I think education will really depend on where your child is because minsan the young ones already have ideas about, sex. So it's a good jump off board na you can talk to them about it. Depends how comfortable na everybody is about that.
Yeah, Doc. Thank you.
Thank you, Raquel, and thank you to our speakers. We have so many questions left, but not enough time. So we have to end this Q&A. However, we have taken note of all the questions in the Q&A, the chat boxes, pati yung mga comment boxes, and we'll find a way to get back to you on that. No, kasi this discussion doesn't stop here, and it's a very interesting discussion. Meron pa sana ako itatanong na next, kaya lang no more time. So we'll get back to you probably siguro in the next meron pa tayong future HPV webinars. We can also include that as well. So maraming salamat sa inyo. To wrap things up, here are some of my takeaways from today's discussion. So mostly ang pinag-usapan natin, bakit maraming mga taong nagkakasakit with HPV and what should we do about it? From Dr. Sonia, we learned that an infected person may not immediately develop symptoms. He or she may not know whether he or she's infected, tapos nasa-spread niya yung infection to other people, or maybe because of the nature of the disease, hindi niya alam, hindi naman niya nade-develop yung symptoms kaagad, may develop symptoms years after being infected, and by that time, easily spread na, di ba? A second takeaway is that many issues that complicate the public health measures that are meant to address HPV have to be considered. Kunyari, barriers such as the perception of the vaccine as a sex vaccine, sabi nga ni Doc Sonia. Also, the initial recommendations of the vaccine were skewed for females only. And there are also concerns about a lack of strong health provider recommendations. And this renders the parents much less likely to have their children vaccinated. And from Dr. Kat, we learned that there are many myths and misconceptions about HPV. And the important takeaways from her talk, and I got this from her takeaway slide, is that HPV disease and cervical cancer and other anogenital cancers are preventable and treatable. And every single one of us, not just the health providers, every single one of us has a crucial role in educating everyone about HPV. Kasi sabi nga ni Dr. Kat, everyone has a female loved one, a mom, a sister, a child, a friend, a colleague, who may need to be protected by vaccination and screening. And the important time is to be proactive, and the time to start is now. So before we end, we'd like to ask our speakers for final words. Dr. Remollino, may we ask for a few points you want our viewers to remember from this forum?
It was a joy to be with all of you. Raquel, thank you for your time. And I hope that this will not be the end in terms of HPV prevention and treatment. No? And sana we can make this viral. We can spread it like a virus, no? Um, HPV may not kill as many as COVID, but it is nevertheless a burden, a health burden. And given that we have what what it takes to prevent and to treat it, the question really is how can we translate it to our lives to prevent it and to treat it. So let's put an end to cervical cancer and HPV disease by 2030 here in the Philippines and help us. Thank you.
Thank you so much, Doc Kat. The 2030 goal, let's do what we can. Now, may we have a few words from you as well, Doc Sonia?
Yes, I'd also like to say that I had a lot of fun during this webinar, and I hope that after this discussion, everyone is a little bit more aware of why we should be getting the HPV vaccine and what HPV can do, and that we will include this in our health to-do list. Yun lang.
Thank you, Doc Sonia. And finally, Miss Raquel. Miss Raquel, just a few words, and maybe you can mention your, how our viewers can reach you.
Yeah, we have a website. It's www.mamachows.com. That's where you can order our sumptuous pastries. They're all homemade. We only do what you order, so we don't stock, so you have to order ahead. We offer regular pastries and lactation pastries for nursing mom. My takeaway for this is that I have to really face that my son and my kids will grow up. And I need to have that sit down talk with them. It's just a matter of how I will. Wish me luck on that. Siguro, baka pwede kayong magawa ng class na kids naman for this type of vaccine so that more moms would be aware. As I've said earlier, no, ako hindi ko talaga alam. Yun nga yung parang ginawa sa amin ng doktor na yung sinasabi ni Doc Marina, saksak mo na lang yan dyan, no question asked. At least alam mo na vaccinated ka na. Sinabay siguro yan sa flu o kung ano mang vaccine before. But it was really my mom who said na we have to have the vaccine because my grandma has cervical cancer. And I was really scared of getting the cervical cancer. So I had to say, okay, just tusukin mo na, alam mo yun, ganyan. So mas maraming awareness would be really good. And as a mom, myself, it would be on my hands to let my kids know about the importance of the vaccine. So yan ang aking takeaway. So siguro, babalitaan ko kayo pag na-vaccinate yung eldest ko with my husband.
I was about to say that sit down, talk with the husband, no?
Kasi sabi ni Doc Marie, even if I know my husband is really loyal and all kasi talagang alam ko yan after work, dito na siya sa bahay. He's very domesticated, he's always just here. Pero nga, yung ngayon lang ako nalaman na marami palang types yan. And it doesn't matter if you're monogamous or whatever. Pwede pa rin kayo makakuha. And the fact that it doesn't have symptoms, bigla na lang magulat ka nandiyan na pala. So siguro hindi pa late para mag-vaccine siya. So sabay na silang dalawa. Kasi yung twins, may kasabay naman twins sila. So pwede silang sabay na silang dalawa.
Yeah, oo. So thank you so much, Raquel. Thank you. And magandang point. That was a good point. Maybe we could also look into the kiddies naman, no? What we can do for the kids. And again, it's www.mamachows.com, and she also has an IG account at Mama Chows, MAMACHOWS. So thank you again. Before we end, the Mu Sigma Phi sorority, medical sorority, would like to express our gratitude to our partners, the UP College of Medicine, the Philippine General Hospital, the City of Manila. And this event would not be possible without our co-presenters, In Life Sheroes, the Mu Sigma Phi Foundation, our co-sponsor, Berk Sharp and Dole, and our official media partner, our awesome planet. We are also grateful for the unwavering support of UP Manila Information Management Systems and the UP Manila Postgraduate Institute of Medicine. And most of all, we thank you, our participants, for spending your lunch hour with us. Again, we remind all healthcare professionals who are interested in obtaining CPD units to please fill out the evaluation form at tinyurl.com/mewebinars2 2021 eval within 3 days after the forum. You may find the links to the evaluation forms at the comment boxes of FB Live, YouTube, and the chat box of Zoom. We would also like to invite you to be with us again on the next leg of Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on this December 14, 2021, Tuesday from 12 to 1 p.m. And this webinar is entitled HPV Gone Viral, Achieving Quiescence in Adolescence, rhyming pa, or HPV Gone Viral, ang pag-iingat sa murang edad. This will focus on the burden of disease, risk factors, manifestations, diagnosis, prevention, and treatment of HPV infection and disease among adolescents. And for that webinar, we will be having Dr. Sybil Lizan Reyes Bravo and Dr. Maria Virginia Santos Abalos as our speakers. And again, it will be moderated by yours truly. And likewise, please support and participate in our year-long Women's Health Forum series. So on behalf of the Mu Sigma Phi sorority, this is Wendell Rosario Raymundo. Thank you very much and have a good day.
Thank you for attending the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The Mu webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In Life Sheroes and the Mu Sigma Phi Foundation, and co-sponsored by Merck Sharp and Dome. And this event is covered by our official media partner, Our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/mewebinars2021 eval. Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/mewebinars and our Twitter timeline at twitter.com/mewebinars. You may also email us at mewebinars2122@gmail.com. Before we end, we would like to invite you to the next leg of the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on December 14, 2021, Tuesday from 12 to 1 p.m., entitled HPV Gone Viral, Achieving Quiescence in Adolescence, or HPV Gone Viral, ang pag-iingat sa murang edad, which will give perspective on HPV infection and disease among the adolescent population. The speakers will be Dr. Sibyl Lizan Reyes Bravo and Dr. Maria Virginia Santos Abalos, and to be moderated by Dr. Wen Raymundo. We will also be having Miss Nins C. Licad, one of the writers in Manila Streets, as our reactor. And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for